So hello dear friends and welcome back to the channel. My name is Panagiotis Georgiou. I'm an ENT consultant, currently working in Cyprus, specialized in Germany. And on this channel we're tackling ENT topics with high yield information. This is an everything you need to know video about cervical lymphadenitis. Let's go and tackle it. So starting with the definition of the cervical lymphadenitis, this will be an acute inflammation of the regional cervical lymph nodes. This inflammation needs to be less than 4 weeks in order for us to consider it acute, and then of course there is the swelling of the lymph nodes. Now, if there is an inflammation of the cervical lymph nodes, a swollen cervical lymph nodes for more than 4 weeks, including an antibiotic treatment for 2 weeks, for example, then consider the option of taking tissue samples to exclude a lymphoma, especially in younger patients, and then consider also doing an MRI before the operation. Now, first of all, we need to tell the general symptoms that the patients are coming with. For example, the first one would be a fever, more than 38.5, it is considered to be a fever, and then reduced general status of the patient. We need to ask the patient if the swollen lymph nodes are painful, non-painful, and then palpate the lymph nodes to see if they are mobile. Now there is a plethora of symptoms according to the reason of the acute cervical lymphadenitis. We're gonna tackle each disease on its own in other videos. But for now, let's see the diagnostic workup, which is more or less the same for all the patients. Very important step, and never skip it, no matter how much time you have in the emergency room or in your outpatient office, is anamnesis. I always use the ABC rule for the patients with acute lymphadenitis. I ask them if they have been to trips lately, that's Egypt, and then if they have B symptoms like losing more than 10% of their weight in the last 6 months, if they're sweating at night, or if they have fever more than 38.3. And then of course, this is for, the C stands for cat. And this is if the patients have any pets at home, if they work in a farm, if they work in a vet office or in a rescue home. Now, of course, very important will be the ENT status. Here we need to search for a focus. So we'll need to check the ears. Maybe they have an acute external auditory canal infection, or maybe they have an otitis media, acute prurient otitis media. We need to check the oropharynx, if they have tonsillitis, pharyngotonsillitis, if there is any suspicion of mononucleosis, yes, and then also the nose. Don't be afraid to use the endoscope, rigid or flexible in this case, in order for you to be able to grasp a better picture of the nasopharyngeal space and laryngeal space. Now the third step in the diagnostic workup, and it's very important, it's also the ultrasound of the neck. Here we need to count how many lymph nodes are there, how many are swollen, where are they, the swollen lymph nodes. If they have a hilum or not, are they more wide than tall, are they unilateral or bilateral? Of course, alarming signs will be a unilateral manifestation of the lymph nodes with no hilum, and when they are more wide than tall, if they have a necrotic center, of course, and if they're rested in any particular area, for example, level 5 of the regions of the neck in the cases of a nasopharynx carcinoma. Now the next step will be blood work. Blood work, not only a blood panel for hemoglobin, for the basic blood analysis, but also differential count for the lymphocytes, neutrophils, etc. What we expect here is we expect in a viral infection to have an increase in the lymphocytic count, where in the bacterial infection we will have an increase in the neutrophilic count with a left shift. Now, very important are of course CRP and erythrocyte sedimentation rate. Those shows us the inflammatory status of the body, and at the end, of course, serology. The serology status we're going to discuss in a little bit. We are talking about lymphotropic viruses and bacteria, and how can we test them during making a blood test. Of course, don't forget, if you have central necrotic lymph nodes, very important will be also an MRI and the planning of a panendoscopy in order to search better for a focus. Here you're searching a head and neck tumor focus. Now, what I mean with lymphotropic microbes, these are microbes that you can test with a serum titer, and these are causing swollen lymph nodes. Here I have a mnemonic that works for me. Can AVB the cutest hitman ever? Evi is of course my wife. And C stands for CMV, E stands for EBV, B stands for Bartonella or the cat scratch disease. D stands for Toxoplasma or tularemia, and then C for Coxsackie virus. And this hitman is a combo of 3 diseases. The first will be HIV, then tuberculosis, sarcoidosis, or mumps. Now here I want to tell you also about some neurotropic microbes. If a patient has sudden deafness, if the patient has meningitis or a facial palsy, you will need to exclude the following. I have here the mnemonic HBHV. HBHV. H stands for herpes, either type 1 or type 2. And then we have the Borrelia infection and of course the varicella infection. Now for the differential diagnosis, I always use this mind map. I have it memorized and it helps a lot with the differential diagnosis. You can separate the acute lymphadenitis in 2 main categories. One will be the non-specific lymphadenitis and the second will be the specific lymphadenitis. Here for the non-specific lymphadenitis, it can be viral or bacterial, and here we have in the viral aspect the pharyngotonsillitis, pharyngitis, rhinitis, rhinosinusitis, very common diseases, viral infections of the upper respiratory tract. We also have here bacterial infections, of course, an anaerobic infestation due to teeth caries or a peritonsillar abscess or an acute purulent tonsillitis with a streptococcal infection more commonly, or a staphylococcal infection. For the specific lymphadenitis now, we have 3 or maybe 4 categories. The first category will be viral infections, then bacterial infections, and then autoimmune infections, with the fourth coming to be metastasis from the head and neck tumors. On the viral aspect, we've talked about it. It's CMV, EBV, HIV or mumps viruses that are causing regional cervical lymphadenitis, and then we're moving to bacterial lymphadenitis, as you can see here. We've talked about this as well. That's Bartonella, Hensley, cat scratch disease, Toxoplasma gondii for toxoplasmosis, then Franziella or Pasteurella tularensis for tularemia, and then we have TBC, tuberculosis from Mycobacterium tuberculosis, diphtheria, very rare to see but very deadly. We're gonna speak about it in another video, and then syphilis. Of course, we have here the autoimmune diseases that are really important for you to exclude from your diagnosis. For example, sarcoidosis, systemic lupus, rheumatoid arthritis, histiocytosis X, and Castleman disease. Castleman disease, you will be able to diagnose it only with a tissue biopsy, and this is a type of lymphoma, an angiofollicular lymph node hyperplasia with a lymphoproliferative disease. And then, of course, histiocytosis X, a very rare diagnosis with an eosinophilic granulomatosis because of the proliferation of the Langerhans cells. Both of these diseases will need an oncology referral. Never forget the metastasis of the head and neck tumors more commonly seen with HPV-associated oropharynx tumors, we will see a central necrotic part of the lymph node. This is all, folks, for the cervical lymphadenitis. Don't forget to like and subscribe the video. More videos will be coming your way with high-yield topics and high-yield information for you to work with.